Okay, everybody can hear me?
Yes, we can.
You're good to go? Okay, everybody. Assalamu alaikum wa rahmatullah. My name is Dr. Asif Shahzad, and I'm a GP in Brisbane, and I'm a volunteer and member for Australian Islamic Medical Association. نحمده ونصلي على رسوله الكريم أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Jazakallah everyone for joining us for this AIMA Ramadan Initiative series of talks. This is the second webinar, and Alhamdulillah, there is another planned for the next week as well. As you can see, the topic of this webinar is Healthy Ramadan, Healthy Fast and Healthy Ramadan. And we have a very eminent panel of speakers who will be talking about different specialities and how they are relevant to fasting and Ramadan and to our health is affected by them during the fasting. But I'd like to explain a little bit more about the AIMA Ramadan initiative. The AIMA Ramadan initiative is it's a dedicated program that supports the healthcare professionals both spiritually and physically during Ramadan. It equips them with the knowledge to provide the informed and compassionate care to Muslim patients who fast, ensuring medical decisions align with their religious observance. Additionally, the initiative educates the public on the health benefits of fasting, bridging the gap between the faith and well-being. This initiative has been running for a few years now, and Alhamdulillah, it is becoming more and more inclusive in terms of both the participants and both the speakers. We would like to thank you everyone who has taken time to join us this afternoon. I know it's the weekend when it is very busy to spare time from the family time and from our busy schedules. So we are very grateful. We're very grateful for our speakers as well, who I'm personally aware that have a very busy schedule. So we will make a little dua and then we will move on to Quranic reflections. سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم اللهم علمنا ما ينفعنا وانفعنا بما علمتنا وزدنا علما. Bismillahir Rahmanir Rahim. So the first speaker we have in our to open the webinar is our second year medical student from James Cook University, Brother Abdullah, who has volunteered himself for Quranic recitation and reflection. Over to you, Brother Abdullah.
Assalamu alaikum wa rahmatullahi wa barakatuh. We'll begin with the first verse. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وننزل من القرآن ما هو شفاء ورحمة للمؤمنين ولا يزيد الظالمين إلا خسارا. Now this verse is in chapter 17, verse 82, and it translates to, we send down the Quran as a healing and a mercy for the believers, but it only increases the wrongdoers in loss. This verse speaks to the healing power of the Quran, both physically, mentally, and spiritually. When Allah subhanahu wa ta'ala mentions that the Quran is a shifa, a cure, it refers not only to the physical healing, but also to the healing of the soul and the heart. The guidance of the Quran addresses the root causes of the mental and emotional distress, and it offers a remedy that comes from Allah's words. The Quran provides a sense of peace, balance, and direction to those who approach it with sincerity. In terms of health and well-being, this verse encourages us to view the Quran as a source of mental and emotional nourishment in times of difficulty, be it a physical illness, mental, or spiritual. The Quran offers not just the physical cure, but a rahmah, a mercy that fills the believer, guiding them toward greater peace and well-being. To take from this, my brothers and sisters, we must ensure that in our pursuit of well-being, whether through physical, mental, or emotional health, we turn to the Quran not just as a source of wisdom, but as a spiritual medicine. Now for the second ayah. بعد أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم يا بني آدم خذوا زينتكم عند كل مسجد وكلوا واشربوا ولا تصرفوا إنه لا يحب المسرفين. This is in Surah Al-A'raf, chapter 7, verse 31. It translates to, O children of Adam, dress properly whenever you are at worship. Eat and drink, but do not waste. Surely he does not like the wasteful. SubhanAllah, this verse addresses several important aspects of well-being, both spiritual and physical, and offers us a practical guidance for maintaining balance in life. Firstly, it encourages us to maintain our personal hygiene and present ourselves respectfully, which is a part of self-care and maintaining good health. The second part of the verse advises moderation in eating and drinking. So to enjoy the blessings, the ni'mah of food and drink without overindulgence. Now, what's the takeaway in regards to well-being? This verse offers us invaluable guidance for maintaining a balanced and healthy lifestyle, which encourages moderation in our eating, drinking, and our self-care. It teaches us that well-being isn't just about fulfilling our physical needs, but also about approaching life with balance, discipline, and respect for the body and soul. By doing so, we align ourselves with the Book of Allah and the teachings of the Prophet Muhammad sallallahu alaihi wasallam. Lastly, I will end with this hadith where the Prophet Muhammad sallallahu alaihi wasallam said, "The son of Adam does not fill any vessel worse than his stomach. It is sufficient for him to eat a few mouthfuls to keep his back straight. But if he must eat more, then a third for his food, a third for his drink, and a third for his breath." Jazakallah khair. Assalamu alaikum wa rahmatullah.
Jazakallah, Brother Abdullah. What a beautiful recitation. MashaAllah. May Allah reward you for this. May Allah help you grow in your pursuit of knowledge and accomplish your goals in this world and hereafter, inshallah. It amazes me how much we can learn every time we return to Quran. And there is never an occasion when there is no solution from the Quran. So thank you for a great reminder that we need to return back to Quran to actually seek our not only the answers to our worldly questions, but also our physical as well as for our mental health, spiritual health at all. And Jazakallah for also reminder as etiquettes of eating during the Ramadan as well, because indeed we all know that there is a room for improvement. Collectively, we have a habit of actually observing exactly opposite of what is intended to in terms of our dietary routine and changes in Ramadan. Jazakallah once again. Beautiful reflections. It's time to move on to our first speaker. I have great pleasure in introducing to you all my friend, my colleague, an eminent gastroenterologist and liver specialist here in Brisbane, Dr. Muhammad Asif Shahzad. Asif is um, IBD lead at one of our busy hospitals here at Logan, as well as he is very well published, very well cited researcher. He is the examiner for his College of Physicians, but also I'm told that he is the mentor for the examiners. MashaAllah, he has achieved so much in his life. He's a busy father. He's very committed with his family. And in addition to that, he runs a private practice by the name of My Gut Care. So I'm very grateful, Asif, for sparing time on such a short notice I've heard you on other occasions, and I'm looking forward to your talk in the context of Ramadan. So over to you, Brother Asif.
Jazakallah khair. So I'll just share my screen. Can you guys see it?
Yes,
Yep.
yes, we can see.
So just minimize this. All right. So thank you very much, Jazakallah, again for inviting me for this presentation. So the topic I was given today was Ramadan and what is the common digestive symptoms that we experience and how can we minimize them, and if we have, how can we treat them? So let's start. Bismillahirrahmanirrahim. Agenda for my talk would be what happens to the gut in Ramadan. What are the common gut symptoms that Muslims feel during Ramadan? Why do they feel it and how to manage them? And the most common symptoms that the people do report during Ramadan is either gastroesophageal reflux disease or constipation, and how to manage other gut diseases in Ramadan. And then there will be summary. So let's talk about what happens to gut in Ramadan. So, and this is a fairly evidence-free area, but there are a few papers that have been published in this territory. So most human studies indicate that the positive effects of fasting on the composition and structure of the gut microbiome. So body goes in a mild state of nutrient stress, which stimulates the body's cellular process and improves the process of elimination toxins from the colon. I just want to see sorry, sorry. You guys can still see me or not?
Yes, we can see the screen. Yes.
But I somehow lost myself in there, which feels very weird that I'm not talking to anyone. But anyways, I'll just carry on.
We can hear you very well.
Yep. Okay, no worries. So, all right. So I was talking about the body goes in a mild state of nutrient stress, which stimulates the body's cellular process and improves the process of elimination of toxins from the colon. So the decreased inflammation and pro-inflammatory cytokines stimulate autophagy. We all are aware of that. We might have heard of on social media in particularly that autophagy prevents the cancer, which helps body recycle, remove degraded cellular components and promotes cellular renewal. So shift in the night eating, however, has an effect in circadian rhythm, release on leptin and ghrelin, which are our appetite stimulants and appetite suppressant hormones. So to me, Ramadan is a temporary lifestyle change. So if we think about our normal routine, we wake up, we have a morning coffee, small breakfast, and then we wait for our lunch, we keep up with our water intake throughout the day, do some exercise, and dinner at a time that suits us, and then we go to sleep accordingly. However, in Ramadan, we have to work on a particular timings and a discipline. So we wake up early in the morning for a feast. We pray our Fajr, we then go to sleep again. There's no fluids for 12 hours. So that's a stress to our body. And then we eat at iftar, and sometimes we eat a lot. We can't change the time. There has to be a particular time. Then we do Maghrib, Isha, we eat again and sleep soon after eating. Sometimes we're sleep deprived, and we all know that sleep deprivation can affect the gut motility, means constipation or diarrhea. But we're doing it all for Allah, but if we do it better, then we may not affect our gut health. I want to throw a concept of hunger versus appetite before I jump into the actual problems. So hunger is a physiological impulse to eat that is triggered by starvation in order to maintain the energy balance. So it's eating enough to live. Whereas appetite or hedonic hunger is a food intake driven by pleasure rather than a metabolic necessity. So even if our body doesn't need that much, we keep eating it because of the pleasure that we get. So if we can control the hedonic hunger in the Ramadan, we can have a better gut health. So in either situation, whether it's appetite or hunger, it requires an exquisite coordination between the brain and the gut. Functionally and evolutionarily, hunger can be characterized through three distinct but highly interconnected mechanisms: homeostatic hunger, hedonic hunger, and microbiota-driven hunger. On this photo, which is from New England Journal of Medicine, I only want you to focus on this hunger triggers, which is in hedonic hunger. And this is what we struggle in Ramadan. We have our bodies under stress. We eat because of our habits, emotions, our lifestyle, and psychological eating. And this is where the problem is. If we get symptoms of gut health in Ramadan, we focus on hedonic hunger. We don't eat it because we have to eat it. We eat it for pleasure. And Allah says, as Brother Abdullah was also mentioning, eat and drink and do not commit excesses. Indeed, He does not love those who are excesses. Similarly, this is exactly the same hadith which Brother Abdullah was saying, that a human does not fill any container that is worse than his stomach. It is sufficient for a son of Adam to eat what will support his back. So it means eat enough to live. If this is not possible, then a third of a food, third of a drink, and a third of breath. So what are the common symptoms of that we see? As I mentioned, I'll focus on reflux and constipation. So why reflux is common in Ramadan? First of all, fasting can alter the circadian rhythm. We eat more at night time and we are not eating throughout the day, which is our normal rhythm. And that leads to variation in the gastric pH. Main factor for getting reflux is lifestyle and diet related. The way I think is that Allah Ta'ala knew that it's going to be the whole day without food, and then we're going to eat overnight. There must be a benefit, and we know there are benefits. But why we get symptoms? It's only because we change our lifestyle too much that we damage, in fact, our stomach or gut health. When we eat anything, there is a process of gastric distension starts. That stimulates the acid glands in the antrum of the stomach to produce acid. The more the distension is, the more the acid secretion would be. Now you can imagine at iftar time how much stress we put into our stomach to stimulate the acid reflux. Late night meals. This is the time when the stomach is not used to produce acid, but we are asking the stomach to produce more acid because we are eating at that time, because we are afraid that we're going to be hungry all day tomorrow. Spicy food, lack of fiber, they all have different factors, which I will leave that with dietitian, which is our next speaker. But these are the common reasons to why reflux is more common in Ramadan. But how do we manage it? So, as I mentioned, it's a lifestyle issue. Some people do have reflux disease, and some people develop reflux during Ramadan. If someone has reflux disease, there is slight modification in their medications, which I will touch on this one. And some people who develop reflux during Ramadan, because it's a lifestyle issue, I will focus on the lifestyle changes that they can make to minimize the risk of developing reflux. So let's talk about suhoor. But when I speak to my patients, I suggest them to wake up early at the time of tahajjud if possible. Drink plenty of water at least 15 minutes before eating. So taking water after food is not a good indicator. It can lead to more reflux. After eating, after finishing the suhoor, we should stay upright for at least 30 to 60 minutes, do your housework or do Quran recitation, whatever it needs to, but do not lie down straight away. If we need to take PPI, then take on an empty stomach. Straight away after when you awake, just take the PPI straight away, 15 to 30 minutes before your meal, because it works effectively if it's taken on empty stomach. Hopefully that will get you through the whole day without having the reflux symptoms. Then at iftar, again, if you have reflux disease and you know that if you haven't, you must take your medication before your meal, which is impossible in iftar, you should change your behavior or lifestyle slightly to not get those symptoms. And how do we do that? You just take the dates, your beverage, water, the best beverage at the moment, and preferably do not eat much. Go for your Maghrib and come back and eat. By this time, and even if you want to take your PPI, this is the time you take it. And then by the time you come back from Maghrib, the PPA has started working, and you can now enjoy your food without having the symptoms of reflux during your Taraweeh, for instance. Eat in moderation. If need to take acid suppressants after you have eaten, PPIs are probably not the best choice. And I generally suggest to alkaline-based therapies, for instance, Mylenta or Gaviscon, which are liquid forms. The Gaviscon double-strength chewable tablets are very effective, particularly after food. I generally suggest to sleep on right side. That's also a sunnah, and there's a theoretical and medical benefits of sleeping on the right side that reduces the chance of reflux. And once again, the food recommendation, I will leave that with the dietitian. Okay, so the next common symptom that we encounter is constipation. So in terms of constipation, again, that is quite common in Ramadan. And why it happens? Because there's a change in the gut microbiome. Once again, it's a change in the lifestyle, and that affects the gut motility. Remember, the motility of gut is the two main factors in there is how moist our gut is, like how much water are we drinking, and how much fiber is in there. And if we're eating fiber, is it a combination of an insoluble or soluble fiber? One other thing we need to remember is that gastrocolic reflex. So when we eat, the food goes in the stomach, there's a reflex goes into the colon from the stomach. Simple message that this human body is eating more. We need to empty from the bottom so that we can create a space. This process starts within 15 to 20 minutes of eating. And within an hour or so, we get a defecation reflex to go to the toilet, to open our bowel. Once again, in the Ramadan, it can be quite challenging to avail that opportunity because we might be busy with the family matters, with the guests, with the Salah, with the Taraweeh, or all of that, and we miss that opportunity. We do get the defecation reflex, but we suppress it. And when we suppress it, eventually we go into the vicious circle when we wanted to open the bowel and we can't open the bowel because the defecation reflex is not there. So it is quite important to modify your lifestyle accordingly so that you can avail that opportunity and not go into the habit of constipation. And because we have not eaten or drunk for at least for 12 hours, in Australia, it's going to be 14 hours this year. So our gut is going to be quite thirsty. So to do that, we must drink enough water. Now, other couple of diseases that we mention, not common, but they can have effect, or often people ask me, what is going to happen with my IBD in Ramadan? So very small amount of studies with patients up to 60 maximum. The study shows there's no significant difference in their self-reported symptoms before and after Ramadan, and no correlation between the number of days fasted and disease severity. Ramadan fasting posted no significant risk to patients with mild or uncomplicated IBD, so they're fine to fast. And fasting does not pose an increased risk to develop IBD or a flare of IBD. In my experience being an IBD lead, I have not seen a single patient who comes to hospital with flare because he was fasting in Ramadan. So what happens to the liver? Common conditions are MASLD and chronic liver disease. If you do blood test in patients with fasting in Ramadan, hyperbilirubinemia is not uncommon in seeing this patient, so don't be surprised of that. ALT and AST usually should improve, and in general, your protein and albumin can go low because of the fasting. And that happens in MASLD patient or in general. For chronic liver disease patient like cirrhosis, that is a question. It depends on their stage, what stage they have, Child-Pugh A, B, or C, and that can theoretically reduce protein caloric intake can be associated with worsening disease outcome. So pre-Ramadan counseling session and a closer follow-up is suggested because many people with such disease, they still want to fast. Okay, and then lastly is my summary, which is Ramadan. We learned that there are lots of benefits on gut health. Symptoms that we experience are majority due to our lifestyle and dietary choices, not because of the Ramadan itself or the nature of Ramadan. As a physician, I suggest a pre-Ramadan counseling with any gut-related chronic disease patients. And the general tips I give to them is to drink plenty of water. In a normal temperature, our water intake requirement is 30 mils per kilogram. So if you're a 100-kilogram person, we need at least 3 liters of water in a day. And we have to accomplish that water intake in that period from iftar to sahur. So that is very important that we accomplish that, and small sips of water over the long period of time rather than big gulp of water in at once, because that will lead to bloating and nausea. Fizzy drinks cause bloating. Caffeine should be avoided because it is a diuretic and it affects the gut motility as well. I always suggest to avoid overeating because that produces acid reflux. And once again, I tell them to eat to your hunger, not to your appetite, hedonic hunger. So avoid foods high in fat because that delays your gut motility, can cause nausea. Don't sleep on full stomach. Eat more fiber because that helps with the bloating and constipation. There are only minor medication modification are required because majority of the gut medications are usually twice a day, which can easily be taken at iftar or sahur, unlike the other cardiology medications, which are often 3 or 4 times a day. So that is for my talk. Thank you very much for your attention, and Ramadan Mubarak.
Jazakallah khair, Brother Asif. MashaAllah, what a great talk. And personally learned a lot, and I'm sure everyone else has learned as much as I did. Alhamdulillah. Just to emphasize that, yes, it is a time of both spiritual as well as physical purification, not the time for feasting, it is time for fasting.
Exactly.
I myself has a lot of room to improve when it comes to iftar and sahur habits, but inshallah we will try to do better every time. Jazakallah, beautiful talk. I'll just like to remind you that we are going to hold question answer sessions towards the end, so if you please hang around, that would be
Sure.
great.
No worries.
May I welcome everyone again as we speak. We alhamdulillah have 71 participants. And thank you for taking time on Sunday afternoon. We are through our first speaker, alhamdulillah, and enjoyed the talk. And just to inform everyone that this webinar is accredited for RACGP CPD activity of 1.5 hours. But those who want to claim this, their points, RACGP requires everyone to complete the evaluation forms, which we will show the QR code in the end. So please take time to complete that QR code if you want to claim CPD points. Also, we would be showing you the QR code for the registration of Melbourne conference, which is coming up on the Easter weekend in April. It's shaping out to be, alhamdulillah, the best conference, and we are looking forward for most of you and your families to see there. Our Victoria team is working very, very hard, and we will want to go and enjoy their program. They have set it up for all of us. Jazakallah khair. It's time to move on to our next speaker. In continuity with the gut health and dietary modifications required in the Ramadan, we have next speaker is our own Zeenia Gul. Zeenia is a dietitian and a health coach. Please join me in thanking Zeenia because she has worked very hard for last year to prepare and present at multiple forums for AIMA, and she is even busier this year doing the same. So may Allah reward you, Sister Zeenia, and over to you.
Thank you. I'll just share my screen. Can everyone see my screen?
Yes,
Yes.
alhamdulillah.
Wonderful. Thank you. Okay. Well, assalamu alaikum, everyone. My name is Zeenia. I am a dietitian and a health coach. I work at Diabetes Australia in Brisbane. And I would like to thank AIMA for giving me this opportunity to talk more about nutrition, healthy eating in Ramadan, and take a bit of a gut health spin on it as well. So this lines up very well with everything Dr. Asif has just mentioned as well. So moving forward, these are the areas we will cover. Just a general note for the public is that my information is general again. It's not specific to any condition or, the best place to go to is a health professional, your GP, if you have any symptoms. But we will be having questions at the end as well. So I'm excited to answer some of those. Like anything, we want to think about why, so the intention. So our intention behind making change is remembering that Ramadan is a time of it's an opportunity. It's a time to eat the way the Prophet ﷺ guided us to develop spiritual discipline, God consciousness, and gratitude as well towards all things, our health, food, our bodies as well. So remembering that it's not about feasting, as we've mentioned, it's not necessarily about iftar parties or weight loss as well. Sometimes that's a thing we hear, but it's more about optimal nutrition. How can we fuel ourselves as best as possible to increase our capacity for ibadah in Ramadan? And remembering that if we know why we want to make change, we can make it effectively. So that's the key there. And as we know, our intention dictates the outcome there. So what we know is that intermittent fasting is good. It's valuable because it reduces our caloric intake and that window of eating. And we've heard lots of benefits and lots of studies have been quoted already. So the bottom line is intermittent fasting and Ramadan fasting are the same in a lot of ways, and we get the benefits from that. But funnily enough, when we practice it in real life, we find that often there are discrepancies. We have higher rates of constipation, indigestion, heartburn, bloating, fatigue, and we're not meeting our nutritional needs in this time. So as we can see in that quote there as well, that it all depends on your diet and that individual's choices around their food, if they gain the benefit of fasting and intermittent fasting specifically. So there's a bit of a disconnect potentially in how we're practicing it and what the research shows around intermittent fasting and its benefits. So as we know, the gut is an organ, it's an ecosystem, it is full of trillions of different microorganisms. There are some things we can't control, for example, our birth mode, our age, but there are things we can control, like our diet and exercise. So it's especially important in Ramadan to emphasize that, to reduce those outcomes that we've listed, the negative outcomes. So diet, what can we do? We can eat more fiber, which we consider prebiotics. I'll discuss that in a moment. We can eat more probiotics, which are live microorganisms that ferment and they produce short-chain fatty acids. So that is a good thing. We're looking to produce more of these because these have health-promoting outcomes. So this diagram is very busy, but it's a good summary of what we're looking to do and what we're looking to not do as well. So you can see on the red side, for example, there are where we eat more red meat in an excessive manner, where we eat higher saturated fatty acid foods, which are deep fried foods, oily foods, where we have more processed foods. We then have negative health outcomes. You can see the high inflammatory markers, poorer lipid profiles, increased risk of chronic disease, and even functionally, diarrhea, constipation, as has been mentioned. So we don't want to be having more of this, but in Ramadan, we end up eating more of these foods daily, okay? So the idea there is we want to change that dynamic to have more dietary fiber, so prebiotic and probiotic foods, to have more health promoting outcomes, so short-term and long-term as well. So that if inflammation, the risk of chronic disease, and overall quality of life, and making the most of your day and your fast. So prebiotic foods, as I mentioned, they are foods that provide your existing gut bacteria good fuel to multiply, to flourish, to create more short-chain fatty acids. And then we see those health-promoting outcomes. So examples of these could be banana, barley, apples, fruit and veg in general tend to be quite high in fibers and they have these prebiotic benefits. There are one sub-type of probiotic foods called resistant starch foods, which are exceptionally good for our gut health. And what these are starchy foods like pasta or rice, if it's oats, for example, where we cook them once and cool them and then consume them, we know that they have a higher impact on our gut health. So the molecules in the starch become more resistant to digestion, which then ferment more, which then produce more short-chain fatty acids and overall better health outcomes. So if you think about like fuel for a car, it'd be like 98 unleaded fuel compared to 91, which you'd get from the general benefit of fruit and veg. So resistant starch is something to have more of. And we know even in the Sunnah, there are specific foods that have been listed for us to consume more of. For example, barley, honey, cucumbers, dates, figs. So we're so fortunate to have that ingrained in our practice, in our way of life. So that's something to acknowledge, to have even more of these foods. And we know that the Prophet ﷺ ate mostly a vegetarian diet, which is very opposite of what we do these days. But we want to be eating less meat overall, specifically red meat, and having more than fruit and veg and legumes would then increase our fiber, and then associating that with those better health outcomes. So that's your prebiotic foods. And now probiotics. So probiotic foods come in categories. So for example, if we're looking at foods that provide live bacteria. So for example, if we take Greek yogurt, it has live bacteria in it. These live cultures then almost become friends with your existing gut bacteria and help that bacteria multiply really in a high yield way. So we see better health outcomes there. So kefir, yogurt, both are really wonderful for our gut health to be including day to day. And then otherwise, there's images there you can see are fermented foods. So for example, kimchi, pickles, different types of like achars, for example, in our cultures we have, and sauerkraut. There's different foods, but there's live bacteria containing foods, and then there's fermented foods. So both are really beneficial and high yield for our gut health. And in the Sunnah, we've also got, for example, honey or milk or olives, or the Prophet ﷺ would have this fermented milk drink that was made of raisins and dates called nabid. So that's another example of where we've been shown how to eat in a balanced and healthy way. So that's what to be eating, but then coming back to how to be eating, we know that eating mindfully is actually an act of sunnah, and it's something that is my bread and butter, is teaching people how to eat slowly and mindfully, and the technique behind it, because we've lost it in this day and age almost. So eating, for example, with 3 fingers is a way that the Prophet ﷺ would eat. So eating a small amount at one time enables you to chew more, which means that you're helping that digestive process, breaking it down more, less work for your body, and then less of those negative health outcomes that we see, because we feel more full easily, for example. So if you're eating slowly, you'll be able to gauge if you're full or how hungry you are in a more accurate manner. So we know that it takes about 20 minutes for our receptors to reach our brain. So we want to slow down to meet that time, chew properly, eat without distractions. And there's a few hadith that mention that the Prophet ﷺ would take multiple breaks to breathe. And he knew that it was something that would make his meals more enjoyable and was better for his health. And if we were to make no change, but just changed how we eat, that would make the biggest difference. So eating slowly, mindfully, chewing. So about 20 chews is what we recommend per mouthful. So yeah, that could be something to improve on as well for all of us, but just acknowledging that it's how we eat as well. Okay, so putting this together, how do we build a balanced suhoor? The goal for suhoor is to feel fuller for longer, okay? So we want to keep our gut happy because, as mentioned, it's not a time that we normally eat. So choosing these foods wisely is essential so we don't disrupt more than we already are in a slight way. So choosing foods that are high protein. So protein is the macronutrient that keeps us fuller for longer. So we want to have high protein foods at this time. This is when you could include a probiotic food like your yogurt or kefir. And then having something that's low GI as part of your meal, which I'll discuss in a moment. The key here is have it be intentional with it, plan the night before, and don't include foods that are disruptive, like caffeine or oily foods, as mentioned. So GI, as most of us are aware, is glycemic index. It's how we rank how quickly our body absorbs the sugars in a food. So we're looking for foods that are lower GI. So being intentional with choosing lower GI options at this time to maximize and sustain our energy levels is really important. I've also attached a handout on the last slide that you could open, and that gives you comparisons of high GI and low GI. But basically, something that's high GI might be, for example, white bread. If we were to have white bread, it doesn't have much fiber, highly processed, not very dense. We could, it's absorbed very quickly. And that means that we have that roller coaster, that up and down of our blood sugar levels, which then can make us hungrier later in the day. Whereas if we have something that's low GI, it's released slowly, and there's more sustained energy in terms of then our goals for the day. So low GI is good. Here are some examples of different foods. You can see there's some proteins, some low GI carbohydrates. You can see the yogurt there, and fruit. So these are just options that you might have at home already. If we bring that together, these are ideas that you could look at. I'll explain the first one. So if you've got rolled oats, that is a low GI complex carbohydrate. That's ideal. So that's your prebiotic food. You've got kefir, maybe, which is your probiotic food. And then your fruit, nuts and seeds, also prebiotic. So bringing that together, that's a very high yield meal that will sustain you better than, for example, having Cocoa Pops. And you could even try that out for yourself for a few days. Have Cocoa Pops and milk for sehri or sahur, see how you feel, and then switch over to a meal like this and see how you feel. There will be a difference. But yeah, that meets all the, ticks all the boxes. Now, the day has been long. We're all very tired and we've dealt with a lot of different people and I'm sure different hurdles and challenges. But the day doesn't stop in Ramadan where we start eating at iftar. That's then the opportunity to maximize our ibadah after. So remembering that it's about energizing ourselves to keep going and to head to Tarawih and do all the things that we need to do to make the most. So the goal of then iftar is to balance your energy levels, to prevent overeating and any gut disturbances. Okay, so the key here is we want to break up our meal. So start with iftar as something that will break your fast and then have dinner after a period of time. So break your fast with dates, maybe a small bowl of soups or fluids, could be a small salad if you like, but just something. What this is doing is it's helping then prep your gut for the meal that is coming. It also helps then with our mental hunger. So we can then plate up and eat as much as we need, not want, which again is something that's been touched on. So breaking that fast up is essential. Have your iftar, wait the 10 minutes, go and pray, for example, which is a form of movement, which will also help your gut. Your gut is also one big muscle. So remembering that, it's going to help balance, and then have your dinner. So 10 minutes later, we've come to dinner. We want to be following this healthy plate model when we're plating up. And this is kind of the formula for healthy eating as a whole. Okay, so if you have a basic plate, you want to have half a plate of veg. It could be whatever you like. It could be a curry, it could be that you have a steamed fresh bag, it could be that you just cut up cucumber, for example. But having that there is really valuable because it gives you the fibers. It then balances the other components in your meal so that you don't overeat. And it means that you're getting different vitamins and minerals. Okay, so half a plate there. And then you've got a quarter of your plate of the lower GI carbohydrate, which we've discussed, and a quarter of the plate of protein. So all of our cultural foods, I can see lots of different cultures here today. All of our foods can match this plate if we try to. And then that will help that portion control and prevent those disturbances in our gut. Okay, so even biryani can fit this model. So I'm sure a lot of you are excited by that. Here are some examples of what meals can look like. You can see that ratio has been followed mostly, and it gives you an idea. Okay, and hydration, as mentioned, is really important. 30 mils per body weight is essential, so you could sit down and calculate that. Practical tips could include carrying a water bottle after iftar and just making sure that you're sipping on water as you go. We know that that's also really important for preventing, for example, constipation, so that the functional issues associated there. And if you're really sick of water, you could try herbal teas or coconut water, for example, or even kombucha, which has a fermented aspect to it, which is, again, that probiotic type food. We know that, nutrition is also medicine in some ways. So we're looking at then fruits that are water rich. So we know that kiwi fruit particularly is really good with constipation. So two kiwi fruit a day is very beneficial for people who have constipation. And in Ramadan, you're then ticking off your fruit and hydration quotas as well. Okay, so bringing it all together really simply, we've got suhoor, we've got some hydration, we've got iftar, waiting that 10 minutes. You're having a meal that's following that portion plate. And then after dinner, you're looking at including some small snacks if we feel like it, but in a controlled manner. So small amounts. We might have baklava, for example, and that's important to us and culturally something we want to stick to. So having this at this time in a portion controlled way, Tharavi, staying hydrated. This is kind of that practical overview of what we want to be doing. Okay, planning is key, most important step. So I've made some planners, this might be from last year, so I've attached them to the slides that will be shared around. You can open them, print them off and use them. Printing off that healthy plate can be a very useful visual cue to have around the kitchen, put it on the fridge, for example, and using it as a guide. Planning could come to sitting down with your family and writing down meals that everyone would want to have, but following that kind of structure as well. So you could bulk prepare your suhoor if you wanted to, one less thing to think about, or the salad on your plate, prepping that up for 3 or 4 days in advance so that it's already ready to go in the fridge. You're all quite busy, so just acknowledging that, make it easier for yourself. Okay, and here are just some Arab meal ideas. We've got really different cultures here today, so just generally, there you go. Western meal ideas. You can see that portion plate's been followed very well there. And then moving forward, desis, you can see that there's some options there as well. I can see Dr. Asif smiling. There you go. And we're going to have a short quiz as well. I'll just get you to think of the answers. You don't have to unmute your mic or anything, but just to make sure we're all awake still. So which of the following is an example of resistant starch? That's one of the things we spoke about. Is it white bread? Is it cooked and cooled rice? Is it milk or apple juice? Okay, that's question 1. Question 2, how many samosas should I have at iftar? Is it 1? Is it 0? Is it 10? Is it or 5? And lastly, what would be the best gut-friendly drink? Is it Coke, no sugar, fruit juice, a milkshake, or warm water? Okay, so cooked and cooled rice is correct. That's that resistant starch that we spoke about. How many samosas to have? This wasn't a trick question. It's okay to include our traditional foods. So have a samosa, but remember it's about moderation. So 1 at each meal rather than none. Yeah, if we have none, we overdo it. It's that all or nothing mindset. And lastly, we've got the best gut-friendly drink. So warm water would be the ideal. It helps our gut digest. And that was mentioned as well by Dr. Shahzad. So there you go. Thank you all for your time. I really appreciate it. And the resources I mentioned have been hyperlinked in my slides. Yeah.
MashaAllah, Zeenia, Jazakallah once again. Very pleased for your presentation. Alhamdulillah, wonderful job. And you have adapted to the nuances of the cultural foods, MashaAllah, very well. While you were just doing some question answers, some of the participants did answers quite correctly. So, Alhamdulillah, it's great to see that people are so involved and answer the questions. I personally don't like presentations where I'm in an exam kind of situations, but because you mentioned samosas and rice, and so I was involved in that as well. Now, Jazakallah again, I can remind you that the foods you showed that you should not eat, samosa was not one of them. And then you said biryani is okay as well. So Alhamdulillah, for us, it is good. But on a serious note, it's room for improvement. Very, very nicely prepared presentation, and Jazakallah. Please hang around for our question answers. you ask the questions. Now it is going to be participants and attendees' turn as well. So please stay with us. I'd like to remind everyone that these presentations are of a general nature and they are a general advice. If anyone has particular conditions or need any specific advice, it is best to seek individualized advice from an accredited practicing dietitian or your gut health professional so that you can actually get the nuanced and tailored individualized advice for your circumstances. Alhamdulillah, we are going on time as well, which is good because we are going to save time for question and answer sessions. And I would like everyone to remind in attendees that please be prepared for your questions. You can put them in a chat box, and but also we will unmute the attendees, and please raise your hand if you want to ask questions, and we will involve you. Would love for you to be involved in this discussion, inshallah. Then we move on to our last speaker. We are privileged to have Dr. Omar Farouque with us. Dr. Omar Farouque is an eminent cardiologist, interventional cardiologist at Austin Health, Austin Hospital in Victoria. He's very experienced. He was born and bred and raised in Adelaide, did his education and PhD in Melbourne, and has been, mashallah, not only looking after the patient, but looking after the people as a director of his department for the last 18 years or so. He's very dedicated. He's very enthusiastic about the education, teaching, and training. And he was very kind to prepare some time. While we were having a discussion with them, the way evidence-based medicine works, mashallah, these cardiologists and our specialists have a wealth of knowledge. So it's not a problem for them to actually talk about the latest studies and trials for hours and hours. But I just reminded them, and they have been very kind and mindful of this fact, that our audience is primarily GPs and healthcare professionals, and not necessarily only their specialty people, and they have adapted their talks very well. So it's cardiology is very, very important topic. We know that a lot of our patients have cardiac conditions, and this is an area which generally goes unanswered, and there's a lack of information as what to do someone who has a particular cardiac condition, and how they should they fast, should they not fast, and what changes, what adaptation needs to be made. And given that scarcity of the cardiologists, they're not easily available to most of us, unfortunately, these very important questions often go unanswered, and it leads to some of us not making the informed decisions. And sometimes we can be overambitious and make decisions when we should not fast, or sometimes we end up actually not fasting when we are able to. Let's be grateful to Allah that in our community in Australia, the body of healthcare professionals is growing. And what I personally enjoy, and I'm grateful to the platform of AIMA, that they bring those professionals into the network and into for the provision of the services to our Muslim patients who connect their faith to their profession, and how best we can be professionals, as well as how best we can be practicing Muslims in a community like Australia. Of course, these education sessions are as per the standards of continuous professional development for any health professionals. And as I was talking to Dr. Omar Farouque last night, that inshallah, this work we are doing will be recorded, will be published, and it is on the college's website. So this is our little contribution towards for the future work in terms of Ramadan, and people who want to do their research and prepare their talks or presentations. I'll stop here. I'm very excited. Can't wait to introduce you to Omar Farouque. Over to you, Dr. Omar. Assalamu alaikum.
Walaikum salam wa rahmatullahi wa barakatuh, brother Asif, and to all of those online. I hope you can hear me and see my slides.
Yes, we can hear you.
Great, thank you very much. So the topic of my presentation will be Ramadan fasting and its impact on patients with heart disease. And I thought I'd just take you through a few general remarks before I look at some specific conditions. So as everyone knows, fasting in Ramadan is associated with significant changes in dietary patterns, fluid intake, Physical activity levels, probably most of us tend to be less active during the month. Sleep patterns can be altered, all compared to non-fasting months. In addition to that, the conditions of our fast vary according to geographic location and also the time of year. This coming Ramadan in Australia, the duration of the fast will vary a little bit based on latitude, but it's probably going to be about 11 to 15 hours, the longer durations in the southern states like Tasmania. And as the month progresses, the duration of the fast will lessen. So about 11 to 15 hours. And that's certainly much less than some parts of the world where the fasts can be much longer. And in addition to that, we've also got to consider the impact of the seasons and the temperature and so forth, because that may have an impact on volume, state, fluid intake, etc., which is very relevant for certain types of heart disorders. In preparing the presentation, I looked at what was actually available in terms of evidence as far as guiding decisions. And while there is a reasonable amount of data, I wouldn't consider it to be a large amount, and certainly not in sort of the last few decades. But there is some information, and I've sort of referenced a few important papers that I saw that you may want to refer to in the future. But a question that might be asked is whether fasting in Ramadan is associated with adverse cardiovascular impact. And in general, I think we can say that it is not associated with adverse cardiovascular events. So in particular, there was a meta-analysis that was published in Canada, and they looked at three particularly important conditions: stroke, heart failure, and myocardial infarction or heart attack. And they found that these events did not occur more or less frequently during the month of Ramadan versus other months of the year. So that provides some good general reassurance that it is medically safe for a large segment of the population. In addition to that, there are two guideline documents, which are very nice summaries that I'll direct you to, published in the last 3 or 4 years, one from Turkey and the other from the United Kingdom. And these documents provide doctors with some good guidance about specific cardiovascular conditions, and I'll touch on these through the talk, about when it might be safe to fast and when it might be best avoided for medical reasons. Now, I'll just touch on some of the cardiovascular benefits of fasting in Ramadan. And there is evidence that fasting in Ramadan can result in improved vascular endothelial function. The endothelium, of course, is the inner lining of blood vessels and the largest organ in the body. And this is a nitric oxide dependent phenomenon where one might have improvements in endothelial function. There is also some lowering of blood pressure. Let's call it small, roughly 3/2 millimeters of mercury during the month. We've heard a little bit about changes in body composition, reduced body weight and so forth in overweight subjects has also been observed. There are reductions in markers of inflammation and oxidative stress, and even improvements in lipid parameters. So there are definitely indications that these surrogate markers of cardiovascular events are improved during the month. So this is also very reassuring. Now, this particular diagram or table is taken from one of these guideline documents, the one published from the United Kingdom, and it relies upon the experts in their fields in the United Kingdom, their personal experience, the literature, as well as what has been observed from other societies, particularly in the diabetes space. And if I take you through the green panel here, it's sort of color-coded like a traffic light. But if you have stable hypertension, stable angina, heart failure, which is stable, patients with permanent pacemakers, those with mild to moderate valvular heart disease, or arrhythmias that are sort of non-life-threatening, mild pulmonary hypertension, it may be safe to fast. And I think it's quite reasonable to to fast if you have these conditions, providing they are medically stable. You then have another group of conditions which this guideline document considered high risk. So these would be patients with poorly controlled hypertension, those who might have had a recent acute coronary syndrome, patients with advanced valvular heart disease or heart failure, those with at risk of life-threatening arrhythmias, those who might have implanted cardioverter defibrillators. This group of patients probably shouldn't fast because of the potential adverse impact to their health. But again, these are very general guidelines, and it is very important to consider the unique circumstances of each patient in making any judgments. And then at the other end, you have very high-risk patients really who should not fast, as indicated there in this slide. So now my daughter is a basic physician trainee, and she is doing a rotation in cardiology at the moment and has simplified my specialty into 3 primary things: pump, plumbing, and electricity. And, you know, this is probably not an unreasonable characterization, perhaps overly simplistic, but in fact, we do deal with these 3 things a lot of the time. So the rest of the talk, I'm just going to touch upon some of the common disorders that we see and what the impact on fasting in Ramadan may be. So the first is atrial fibrillation, which is the most common cardiac arrhythmia. And really, most patients with atrial fibrillation should be able to fast. One valuable piece of information to know is that fasting does not increase the burden of atrial fibrillation. This is in patients who might have the paroxysmal version of that condition. But those who have permanent atrial fibrillation, that is, they're in atrial fibrillation all the time, typically there are 2 things. One is that we control the heart rate to stop it going too fast, and a common class of drugs we use for that are beta blockers. So, for example, metoprolol twice daily. I think it's safe for most patients to continue that type of drug. BD dosing, of course, can be taken in the morning at the time of the morning meal, and then in the evening when patients break their fast. One interesting thing is anticoagulation. These days we use direct oral anticoagulants to ensure that patients are at low risk of thromboembolism. Probably one of the commonest drugs we use is apixaban, or Eliquis is the trade name for that drug. And, you know, in general, that should be given roughly 12 hours apart. I think here in Australia, because we don't have those very long fasts, it's not unreasonable just to continue the apixaban, but basically to take that when one wakes up in the morning without delay, and then again, you know, perhaps one of the first things to do after breaking the fast. But in some countries where maybe the fasts are very long, one could consider switching a drug like apixaban to a long-acting, you know, a single daily dose agent such as rivaroxaban. Then the other thing is patients who are paroxysmal atrial fibrillators, we often use a drug like sotalol. Obviously, these are drugs that potentially can have pro-arrhythmic effects, so one doesn't want to sort of overdose the patient. In general, we tend to give that 12 hours apart. But I think, you know, a short difference in that isn't likely to cause the patient harm. So I think 80 milligram twice daily, with the caveats I mentioned before regarding timing of administration, it would still be safe to use this type of drug. So basically, no major changes required, I think, for most patients with atrial fibrillation here in Australia. I'll move on to the next condition, and that's coronary artery disease. Again, I would say many patients with uncomplicated coronary artery disease, where the condition is stable, should be able to fast. One interesting thing, though, is that if you have a percutaneous coronary intervention, which is the placement of a stent, either electively or in the setting of an acute coronary syndrome, one should avoid fasting in Ramadan if that event, if that procedure has occurred within 3 months. Now, this is based on a study which I've referenced here of about 300 patients. You know, it's not perhaps very high level evidence, but it suggests that the event rate, the adverse event rate, if one did fast within 3 months of having a stent, is slightly higher. And some of these events were stent thrombosis events. And in contemplating why that might be, potentially, that could be related to compliance, dehydration, etc., increasing the risk of thrombosis. So this is something that I think is worth pointing out and remembering. Drugs like ticagrelor, commonly used antiplatelet, particularly after acute coronary syndromes, safe to continue. Those who have stable coronary artery disease, as you all know, very often using sublingual nitrates for immediate relief of angina is a very effective therapy. And there is a religious opinion that it is valid to use sublingual nitrates for angina relief. But if anyone does have concerns about that, they can certainly ask their imam or religious scholar regarding the validity of that. If you have coronary artery bypass surgery, it's probably best to avoid fasting if it's if Ramadan falls within 6 weeks of that surgery. Again, this is a big operation and it takes time to recover, and one wouldn't want to challenge the physiology of a patient who's just recovering from that type of surgery. Turning to heart failure. Now, this is probably one of the areas where there can be some confusion or concern. As a general rule, perhaps those who have stable heart failure, that is those with minimal to mild symptoms, may be able to fast. But fasting is perhaps not advisable if you have more advanced forms of heart failure. So this is a patient who might have rest symptoms, or someone who has evidence of decompensation, or symptoms with minimal activity, those who might have quite depressed left ventricular ejection fractions. We need to follow the usual principles that we use in managing these patients. So fluid restriction, which is not a problem generally during the month of Ramadan, weight monitoring, the administration of medications on time, etc. Loop diuretics, of course, these are classes of drugs that are given to maintain euvolemia. They do not have any prognostic impact, but certainly can be important for symptom relief. They may contribute to conditions like hypotension and even dehydration if one isn't disciplined about following, proper hydration requirements during the month. And as a consequence, it wouldn't necessarily be unusual to run into a problem with acute kidney injury. And of course, patients with heart failure, like other cardiac patients, do have comorbidities that also need to be taken into account, including chronic kidney disease. So this might be a little more likely if one is using loop diuretics. So it may be worthwhile having that monitored by the physician or general practitioner to ensure that the appropriate doses are used. And some of these patients, really, it may not be appropriate to fast for the risk of medical harm. Now, SGLT2 inhibitors, these are safe for most patients. Of course, this is a class of drugs that was originally used in diabetes, but we now consider this class of drug as being one of the pillars of management for both heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. So providing the patient is eating, their meals and having adequate fluid intake, the studies and the guidance is that it is safe to continue this class of drugs. One thing I might add is that if there's any concern, one could certainly give the patient advice to trial fasting, perhaps in the month before Ramadan, on Mondays and Thursdays. That could be a reasonable way to test one's ability to fast for a more prolonged period during the following month. So that's just another comment I'd like to make. Now, if we look at some other cardiac conditions, I think we could say that fasting is safe in uncomplicated, controlled, essential hypertension. Those who might have severe valvular heart disease, one needs to be very careful because fasting, it is a physiologic stress and may result in adverse impacts if you have sort of advanced valvular heart disease. Patients with single or dual chamber pacemakers are considered low risk and can fast. It is advised that they could have their device parameters checked, in the months leading up to the fasting month. Those who have biventricular pacemakers, which is a very special category, they could fast providing their heart failure is well controlled because these devices are implanted in patients with heart failure that hasn't responded to standard medical therapy, but this is a special case. And I've mentioned, the arrhythmia question, life-threatening ventricular arrhythmias. Potentially fasting might result in some disturbance of electrolytes, etc. So one may need to be cautious in this setting. The UK guidelines have suggested that if you have an implantable defibrillator, you shouldn't fast. But of course, these devices are implanted for various reasons, and it may well be that patients that have these devices in the primary prevention context might be able to fast. And then a rare condition, but one that we as cardiologists see from time to time, hypertrophic obstructive cardiomyopathy. This is a preload dependent condition, and therefore fluctuations in volume state may result, particularly if there's dehydration, in an exacerbation of the ventricular outflow tract obstruction, which may lead to a hazard. So caution in this group of patients for sure. Now, this is my penultimate slide, warfarin for mechanical heart valves. Now, we don't use warfarin much, but definitely mechanical heart valves, these patients need warfarin. And typically, this would be a younger patient that gets this type of surgical intervention. And I've indicated here the target INRs for the types of mechanical valves in the aortic and mitral valve positions. There was a Singaporean study that looked at warfarin and found that there was a statistically significant increase in the mean INR by 0.23 during Ramadan. That's probably clinically insignificant for the bulk of patients, and it's been attributed to changes in diet and possibly lowered vitamin K intake. But it may be relevant in some patients where you're pushing at the higher end of INR, or even those who might be regarded at high bleeding risk. And so a patient like that, you might elect to monitor their INR a little more closely during Ramadan. Okay, so to conclude, I think we can say fasting is safe for many patients with stable cardiovascular disease. Clearly, it's important to avoid compromising the patient's treatment and their cardiac health. And therefore, I would urge patients with cardiac disease, if there's any uncertainty, to consult with your GP and physician before the month. I've touched upon the comorbidities without going into great detail, but these aren't patients with isolated heart troubles. Many of them do have other problems as well. I think we can say that anyone with an acute cardiovascular illness, an unstable patient, should be advised not to fast. And for chronic conditions, I would say avoid making medication changes during the month. Ensure that there's a period of stability leading into Ramadan. And to this end, it might be worthwhile touching base with your GP, perhaps about a month beforehand, to make plans and any adjustments necessary, so that by the time you come to the month of Ramadan, ready to enjoy that month, both spiritually and in other respects, that you are best positioned really to get the best outcome from the month without putting yourself at any risk of adverse events. So on that note, I'll stop, and I'm very happy to join the discussion and answer any questions. Thank you.
Jazakallah, Dr. Omar Farouque. It was a very insightful talk. MashaAllah, very concise and coherent. And I'm sure you dug very deep and far to actually find the evidence for this one and found as much as you did. I like your takeaway messages that for a lot of cardiac patients, it is probably possible to fast if their circumstances permit and their physicians are happy with that. But I think it's very important to prepare for the Ramadan. We all know that our Muslim scholars and Muslim leaders in Masajid start talking about preparing for Islam, Ramadan spiritually. But I think being physicians and clinicians, we need to get this message out to those patients that they need to start thinking about fasting months before Ramadan and start going to your individual clinicians, adjust your medications, have a trial run if they want to, and see how they go. MashaAllah, very insightful talk. It was great to know that fasting is anti-inflammatory rather than pro-inflammatory condition. I'm personally not sure the body of evidence, in terms of why the adverse incidence rate after acute MI is higher when it is actually anti-inflammatory kind of conditions. But again, It depends upon it. As you said, there's a sparsity of evidence, and the body of knowledge is still limited. So I think more research is required for that one. Jazakallah khair. This brings us to the end of the talks. Well done, all the speakers. MashaAllah, you stuck to the time frames. That makes my job easy. And now we will enter the Q&A session in a minute. But if you could stop sharing your screen. You have stopped sharing your screen, haven't you, Brother Omar?
Yes, yes.
I want to share my screen and just show everyone that the next webinar, Alhamdulillah, we have coming up is next month of this series. And it is Healthy Fast, Healthy Ramadan. Again, a great line of speakers, and the topics would be women's health during Ramadan. Very, very important topic. It relates to a majority of sisters and female Muslims. Brother Umar Sharif himself would be talking about sleeping right in the Ramadan, and we will have some smart strategies by Sister Nisa Sharif about Ramadan and diabetes, and it would be moderated by Sister Sohana. Inshallah, it would be a wonderful webinar to just finish off our preparations in terms of health and health perspective for Ramadan. Before we enter the sessions for Q&A, I'm excited to share with you the latest poster which has come from our conference team. Again, setting your compass right, calibrating your compass in Melbourne. I think it would work well. There is a QR code here, which you can actually scan to actually do the registrations. We recommend and encourage all of you to participate and go there. MashaAllah, there will be a great line of speakers, international speakers, very well known all over the world. I had the privilege of actually listening to Brother Ibrahim Rasool, Ambassador Ibrahim Rasool from South Africa, and learned a lot. And so did we all enjoy his talk. Similarly, inshallah, this time there will be a lot of other eminent and well-known international speakers. So this is an opportunity not to be missed. And then we have a line of local speakers, mashallah, our own Australian speakers on various topics. And as you could see, this conference is actually approved for generous amount of CPD, 10 hours educational activities, 4 hours different performance. And I was having a peek into the program, and there's mashallah multiple streams to benefit all kind of participants. From junior doctors to allied health professionals to females, and from all walks of medical specialties and clinical specialties. Just a little reminder, everyone, this is the QR code for evaluation form. And you can start filling it now, or you can start filling it later as with the Q&A sessions. And please remember that this is approved for 1.5 hours of educational activity for RACGP. Those who want to claim the CPD outside the RACGP, they can contact us. Please make sure you put your emails and full name and phone numbers in the evaluation forms, and we can actually send you the attendance and completion certificates, and you can log the activities on your own, inshallah. So without getting delay, I had some questions just picked up from the people who participated in the questions. So before we unmute people, can I just start with one of those questions to Sister Zeenia, if that's possible? Zeenia, there was a question from more of a clarification from a sister that could you clarify about resistant starches? Can we include them in sahur, please?
Yeah, so resistant starch is a type of prebiotic. So like it's a starchy food. So for example, rice or pasta or oats or legumes that have been cooked once and then cooled to room temperature and then consumed. And what that does is it ferments in our body because our body doesn't digest the cooked and cooled starch as well, which is a good thing. and then that results in better health outcomes. So it could be iftar or suhoor, it doesn't matter. But if we're having, for example, oats at suhoor, that could be that you make oats in a bulk batch, like porridge type oats, and then store that for a few days, and then you've created that regular intake of resistant starch over 3 or 4 days.
Jazakallah. I hope sister who asked the question would have got the answer and happy with this. One other suggestion also was, and great tip probably, then, generally we have a lighter dinners and for that one. So maybe how about eating like iftar as a breakfast, as a lighter one, and sahur as a dinner. So making sure that sahur is nice and healthy and iftar is a lighter one. So great suggestion, whatever there. Next question was more. This is actually interesting question, and please answer at your will, all of you panelists. And what about the suggestion for pregnant women? So I guess it relates to the diet. It relates to the gut health as well. That how safe it is, or do we need to do the pregnant women need to make any changes during the pregnancy, during the Ramadan? Sorry. Who wants to go first?
You might be Zeenia is the right position to do it, but you want to take first, Zeenia?
Sure. So the best thing would be to go to your GP and then book in with a dietitian to get accurate advice that's individual to you, and if fasting is appropriate for you. That would be my advice. Yeah.
It's difficult to say something, but I think because it depends on the stage of the pregnancy. But from gut health point of view, I guess if it's a second or third trimester, of course, the risk of reflux is quite high. The gut microbiome does change, constipation, all that stuff can become quite problematic, not just because of the Ramadan lifestyle changes, but also due to your pregnancy. So again, it's not an advice that is easy to give for the entire pregnancy.
Thank you very much. And just again, a note that it is important to go to actually your clinician about the pregnancy. It depends upon the stage. It depends upon what kind of risk the pregnancy falls in. Is it low risk, moderate risk? And as Brother Omar Farouque showed the slide, it is not so binary that one can fast in this condition and cannot fast in that condition. I guess it's the continuum, it's the spectrum, and it's the severity of the condition, and also the comorbidities of the patient, in addition to their particular condition, which determines the relative opinion from their clinician whether they should fast or not. At the end of the day, the decision is the patient's their own, but we as a clinician, and particularly Muslim clinicians, are there to actually support those people and their choices, for them, which is clinically safe to actually fast, which is great. I have a question for Brother Omar Farouque, but I'll come to that in a minute. I'm going to unmute Brother Asif. Can you unmute yourself? You raised the hand.
Hi, good afternoon, good evening.
I'm sorry, it's sister.
Yeah, okay. Yeah, it is. I'm Dr. Layla Asaf. Just one question. When I used to work, so when I have pregnant ladies with the straightforward pregnancies, I tell them if you can tolerate the pregnancy, go for it. If not, you have to stop.
Can you elaborate that comment? What do you mean by if you can tolerate the pregnancy?
If there is no complications, it's straightforward pregnancy, no complications. She can tolerate. She's not fasting. She doesn't have dizziness or anything. She can put up with the fasting. Then go for it. Don't stop it. But if you have any complications that might affect you, then you have to stop.
Great, good advice. And let's remember that Allah has given us, created a lot of ease and easy options for us, for the people who cannot fast. And I think it's part of being grateful to Allah to utilize those concessions and provisions rather than being harsh to yourself and to your body. I'm myself in my practice GP obstetrician, And I realized that pregnancy is, while it is a stressful condition, it's actually physiological, quite an extravagant condition in a sense that volume of everything increases. So generally people don't get dehydrated. Generally people don't get hypoglycemia. It's a hyperglycemic state when the resistance to glucose raises, particularly in pregnancy. There is some evidence that, if, maybe excessive and prolonged fasting could be associated to growth changes. And of course, the safer option and opinion from clinicians, and particularly my obstetric colleagues, is that don't fast to avoid the risk of intrauterine growth restriction. But again, the actual body of knowledge and evidence in this field is small, so it's hard to actually give individual advice in that regard.
One more thing, when Professor Farouque say about the SGLT2 inhibitors, that it is safe for pregnancy, safe during fasting. I'm not very sure because of the risk of UTIs and fungal infections in the groin area. It might not be very good to advise to take them.
What are your comments?
Sure, yes. Yeah, I probably should have touched on or elaborated on my comments. I was probably more concerned about the risk of euglycemic ketoacidosis, which is something that we do see in patients who don't stop those drugs prior to surgery, for example. This is non-cardiac elective surgery, the SGLT2 inhibitors that stopped perhaps 3 days beforehand. So I couldn't really answer the question about UTIs. You are right. I mean, the risk of thrush, etc., in those areas is higher, and infections are higher, it seems, in patients that use it outside of the fasting period. I'm not sure that that's higher during the fasting period.
Because of high dehydration.
Okay.
So UTI may be a very high risk. Right.
Okay. You would know better than me, Dr. Asif, on that point. But I can say that as far as euglycemic ketoacidosis is concerned, the consensus guidelines suggest that using SGLT2 inhibitors is a reasonable option. I mean, the advantage in heart failure is primarily in terms of reducing heart failure readmissions.
Yeah.
So it's not perhaps as powerful as some of the other drugs in terms of its effect. So if you did have any concerns, I don't think the patient would come to any great harm if you felt it had to be stopped beforehand for cardiac reasons. But keep in mind, this is a class of drugs that is used very commonly in patients with diabetes for glycemic management. And I couldn't really speak too much to that particular area.
Yeah, my mom used to take it for heart failure.
Okay. Yeah, it's the latest in the
now, what time my concern is not to stop the medicine, is not to fast.
Yes, sure. I think that's not unreasonable. As Brother Asif mentioned, there are dispensations, so not unreasonable.
Thank you.
I think in the end it becomes a discussion between the patient and the doctor. I mean, I've had patients that sometimes will just do what they feel they want to do despite advice. So,
True.
our job is to advise them, and ultimately it's the patient's choice.
Yeah, thank you.
I can see our panelists are answering questions in the chat box as well. There was a question about what is the best time for exercise in regards to fasting in on iftar, and both Dr. Omar and Zeenia have made comments about that. Dr. Omar had written, I think iftar, I think after iftar might be best. For some, it may be simple as walking to the masjid for Tarawih prayers. That's great. And Zeenia commented, I agree with Dr. Omar as well. You would achieve better yield from your weight training while not fasting, and also prevent further stress in your body. It's your personal choice. Jazakallah for being so vigilant and monitoring the chat box as well. Being a male moderator, I'm not very good at multitasking, so thank you for helping me out out there. Jazakallah. One more question came in the chat box while you were talking, Dr. Umar. Is it okay to take the BP medications, antihypertensives, I guess, at night and calcium medications, supplements in the morning?
Yes, so it's, we sometimes do use long-acting antihypertensives in the evening. Are you suggesting, is the question really about switching it from morning to evening? Is that the spirit of that question?
That was the question about just making an adjustment. As they advise, sometimes the best time to take some kind of medications. Do they need these two medication? Let's rephrase it. What would be the best time to take these medications during Ramadan, antihypertensive and calcium supplements?
Yeah, so I think I don't think it matters a great deal if it was morning or evening because they are drugs with 24-hour actions. In fact, this gets back to the point about what is the evidence for switching. And I think I'm not aware of anyone that's actually done a study like that, looking to see whether it was better to switch. So my general approach to that is if the patient is stable on therapy, I wouldn't make any adjustments. And then, some patients have got access to blood pressure monitoring at home. That's such a common thing these days. And, the real question is if you take it in the morning, are they more at risk of hypotension during the day and dizziness and so forth during the day? Probably not is my feeling for most antihypertensives, but this is something that needs to be watched. There's no doubt. And if there's a way to monitor it, that might be best evidence.
Just thinking while you were talking that if antihypertensive has a combination of diuretics, then you might like to think not take it in the morning because of the prolonged fasting and the risk of dehydration.
Yeah.
Again, it depends upon how your kidneys are functioning. I mean, if your kidneys are already impaired, then it will be even more adversely impacting them.
Yes.
So,
I mean, I think I might add, Brother Asif, that probably the best time to figure this out would be pre-Ramadan and, avoiding making changes during Ramadan, unless the patient was symptomatic. Say if they were symptomatically hypotensive, then you'd be forced into making an adjustment. But the question about diuretics, because you're talking about fixed dose combinations where there's a thiazide in there.
Yes.
If someone's been chronically on a thiazide diuretics, the scientific data actually is that their plasma volume. So one of the effects of diuretics when you're using them in those doses, when you begin using the diuretic, it does fall, but then within a few weeks, it recovers back to close to baseline. And the antihypertensive effect is not because they've lost fluid, but rather because there's a reduction in total peripheral resistance. No one really understands why that happens with thiazides. But I think if they've been on a thiazide long term, I'm not sure that switching it to another time of day or even stopping it would necessarily be wise. I would probably just see how they went if they were taking it in the morning.
Jazakallah. Just leads to that, if you just oblige us with your comment on, you mentioned that it's best to actually prepare for Ramadan. What kind of time frame you would recommend if I'm a cardiac patient, when I should start thinking going to my cardiologist or my lovely GP that I want to prepare for Ramadan?
Yeah, look, I mean, we've said I put a month. It doesn't really have to be a month. There's no reason why it couldn't be a little earlier than that. I think, touching base with your primary healthcare team, the GP, would be sensible at least a month, I would say, out from Ramadan. And, I mean, the thing is about fasting is testing yourself out in a way is how I think, from a drug dosing point of view, from a medication point of view, to know that at least you can have a bit of confidence in going forward. Of course, the month itself is, 30 days of fasting. It's a different situation, but perhaps there can be some reassurance both for the patient and also the doctor that it's possible for that individual.
Yeah, Jazakallah. Brother Abid Majid has asked this question, that advice on, I guess he mean postural orthostatic tachycardia syndrome, POTS, happening during the Tarawih. Any advice on those for those people?
That's a really tough question, and it's a tough condition also. When a patient with POTS walks into a cardiologist's office, we think, oh no, because it's a hard one.
Cardiologist gets tachycardia.
Yeah, that's right, exactly. Yeah, so look, I think, generally, POTS is a sort of a disorder which falls within the spectrum of autonomic disorders of blood pressure control. And it can be really debilitating, many in women who really struggle sometimes with this. And the risk is that a person can have palpitations, they could faint, etc. So I would say if it was happening during Tarawih, I mean, one thing is perhaps have prayer while seated,
Sure.
is one thing, but and do the minimum number of rakats, perhaps 8, rather than a longer period. There might be some ways around that if you want to do Tarawih with conditions like autonomic instability. But bottom line is hydration is really important, and seeing a specialist who might actually have special knowledge in that field.
Fantastic, great. There was sorry, it's a lot of questions regarding cardiology. There was a comment about infective endocarditis, I guess. So the brother or sister who asked this question had infective endocarditis last September and had open heart reconstruction, whereby aortic valve replaced and pacemaker inserted. Also have AF. So before you make a comment, it does seem quite complex kind of situation. It is just a reminder for everyone to please seek individual advice from your cardiologist and clinician for that one.
Yes, I think that's really good
comments.
advice. Yes, thank you. And I hope our brother is recovering from that event.
May Allah grant him health.
I just want to share something with Professor Omar as well, if that's okay.
Please.
What's your feeling about GLP-1 agonist because it's also a hunger suppressant, and if patients are using Ozempic, Wegovy, all of that for weight loss, my feeling is that they should hold it during Ramadan, because GLP-1 agonist using while you're fasting is probably not a good idea. What's your opinion on that?
Are you asking me as a cardiologist?
Yeah, just as a physician.
Yeah. About holding.
I'm surprised that no one has ever asked me this.
Yeah, it's a really interesting question. Again, I haven't dug into it. I'm not sure that there's any evidence about this question because it's a relatively new class of drugs, isn't it?
Yes.
I mean, the thing is that it's taken weekly, of course. There is some evidence that if you stop that group of drugs, that you might gain weight, but it might be, you might actually lose muscle mass, and the weight you gain is not muscle, it's adipose tissue, etc. I think I've heard, but this is probably long-term discontinuation, not sort of a month. Would the reason to stop it be, your concern would be just too much weight loss? So in the month when people are fasting,
plus secondly, GLP hormone level is also higher in Ramadan because you're
yeah.
I mean, if you're using GLP-1 agonist on top of your higher end levels, I think you might be in some sort of issue.
Yes.
So again, I couldn't find any evidence. I was hoping, and that's why, since I didn't find evidence, I didn't even include it in my presentation. But I was hoping someone will ask a question and we will generate a discussion, because it's such a common drug and such a common issue that we face, especially as a gastroenterologist. Should we stop it or not before procedures and etc.? But my general feeling is that we should hold it for 4 doses during Ramadan and then restart it after Ramadan.
Yes, it's probably not unreasonable to do that.
Yes.
If you had any concerns, yes, I agree. Yeah. And certainly we're starting to use these drugs. Well, in fact, it's not PBS approved, but it will happen. I think these drugs will be indicated for some forms of heart disease as well.
Very nice, yeah.
Jazakallah, both of you gentlemen. But I'd like to remind you, along with our other attendees as well, that we have an endocrinologist giving talk next week, next Sunday on this topic. So it would be worthwhile listening, and I'm sure they would have more to say about these medication on this topic. But indeed, there is just so many questions. There are so many aspects to health in fasting. But the message I'm getting personally is that overall, if we prepare well, if we are mindful, if we consult and discuss with our individual clinicians, for most cases, lots of myths can be busted. For a lot of patients, they can fast and they can enjoy the blessings of Ramadan. But at the same time, it would be those who are advised against fasting on clinical basis, they can be sure that it is their doctor who is advising them, not just a hearsay or not unconfirmed, unauthentic kind of knowledge for those ones. Alhamdulillah, it is all going very well. It's we are just around 9-10 minutes past 7, an hour and a half. Very engaging. We still have around 50 attendees, which just shows that how engaging this talk has been. I would like to invite attendees again if anyone wants to ask any questions before we wind it up. No questions from me. I think it was a very Shanil.
Dr. Asif, this is Shanil here. Just want to confirm, the next week the timing would be the same. Would that be 5:30 Brisbane time?
Sorry, ask again, Shanil bhai.
Sorry, like my voice was a bit low. I'm asking, like, next week the session with endocrinologists, would that be the same timing, like 5:30 Brisbane time?
I can share my screen again, and I'll show you that it is actually Queensland time is 5:30 indeed. Yes,
Okay, awesome.
it's wonderful session. And so please take time to actually join for that one. I'll like to take this opportunity again, just once again, to remind everyone of completing the QR codes for evaluation.
Is it the same link for next week?
Yes, link would be shared on the poster as well. I'm not sure it would be same link, given that it is a unique link for every Zoom meeting.
Okay.
Inshallah, we will share the link. And in fact, it should be shared on that poster. I can't see as yet, but inshallah it will be. Can you see my screen at the moment?
No, we can see you.
Because I don't know how to share my screen.
There is something at the top that says share.
Oh, in my case, it was at the bottom, but I found it. So
Okay.
this is the evaluation form. Again, I know it's pedantic and it looks a bit, I'm hammering on that, but you may be aware that we cannot submit your point for RSCGP if this evaluation form is not completed. So anyone, I'll probably leave this for a minute or so while I invite any last minute questions from anyone else. And if you enjoyed this talk, all attendees, please make a special dua for our panelists. Again, while working behind the scenes, our admin, Sister Rubina, Brother Umar Sharif from Townsville, they have been working tirelessly to make it happen. But particularly grateful to our speakers who, some on the very short notice, prepared very insightful and wonderful talks. And above all of you, thank you very much for taking time and joining this webinar. So I'll leave it there while I would invite Brother Abid Majid, who happens to be, mashallah, the president of Australian Islamic Association of Queensland chapter. He would conclude with duas, please. Abid bhai?
Can I say something before he starts the dua, please? Sorry.
Sure, please.
I took photos of the some slides, but it shows the person who is talking, so I'm not stealing them, because I usually take notes and I send it to my Muslim friends and patients and things like that. Is that okay? Am I allowed to do that?
As far as I'm concerned, I don't have any problem with that. Leave it to the speakers and the panelists, their comments about that. But I would imagine, sister, that there are ways and means to actually remove those pictures before you share with other people. I guess in the world of editing, if you could do that, that would be much appreciated.
I can take the photo of the speaker. Of course, I can. But I'm saying, is that okay to share the slides?
I think speakers, none of them actually indicated to me not to actually propagate this. So, and this session is being recorded as well. Please let me know if it is not the case, our panelists. Otherwise, people can share the slides with their family and friends, if that's okay.
Yes, that's fine with me.
Thank
No
you.
problem.
Thank
Same.
you very much. Thank you very much. I'll take your photos off.
Jazakallah, sister, for
No, no,
checking it.
very
So
much. Thank you very much.
it's
Very nice. Thank you.
it's very ethical of you, and of course to our panelists, they are very generous in this regard as well.
Thank you very much.
Jazakallah, everyone. And I'll invite Abid Majid Bhai to actually conclude with duas. And Jazakallah once again from me in anticipation.
Jazakallah khair, Brother Asif, for this nice webinar. And I will really thank on my behalf as well, and AIMA Queensland behalf, all the speakers and all the organizers for this webinar. May Allah Ta'ala reward them. Bismillahirrahmanirrahim. Allahumma salli ala Sayyidina Maulana Muhammad wa alihi wa sallam. Ya Allah, let us all see the month of Ramadan in good health, so that we can take maximum benefit from it, and accept our acts of ibadah. Oh Allah, help and protect our brothers and sisters all over the world who are being suppressed and facing the hardship, especially in Gaza. And please guide us on the right path, and so that the things we have listened and heard today, we can practice on those things in Ramadan, inshallah, to have a healthy Ramadan. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. صلى الله تعالى على خير خلقه محمد وآله وصحبه أجمعين برحمتك يا أرحم الراحمين. إن الله. جزاك الله خير.
Assalamu alaikum rahmatullah, everyone. Enjoy your rest of the evening with your families. Assalamu alaikum rahmatullah.